So rats were the initial carriers of the disease, and then it was actually the fleas on the rats that then transmitted that disease to human hosts after the rats had died. And the symptoms included black sores, which first erupted around the flea bites. Then large swollen protrusions would emerge around the lymph nodes, which, if you don't know, are located around the head, neck, armpits, and groin. These were called buboes. One Italian observer of the time noted that these could be as big as an apple. And then eventually these buboes would release a toxin into the blood that caused neurological damage and later death. The entire process from first contracting the disease to death could take as little as a few hours and as much as a few days. It was estimated that during this era, the bubonic plague had a mortality rate of 60 to 100%. So imagine that, right? People around you would literally be dropping like flies, sometimes going from perfect or at least relatively good health to completely dead in a matter of hours. It would have been an absolutely fucking terrible time to be alive. In terms of the spread of the disease, this particular outbreak of the plague, which lasted a total of 4 years, affected not only most of Europe, but also parts of North Africa, notably in the Ottoman Empire, and it's estimated to have wiped out at least a quarter of the European population and between 75 million to 200 million people globally. There would be subsequent outbreaks of bubonic plague, but none would be quite so catastrophic as this initial pandemic. So in this first outbreak, some of the earliest and hardest hit areas were the city-states that acted as the trade epicenters of Europe. And again, this is quite familiar for us if we think about like how the COVID-19 pandemic ballooned from like a relatively localized outbreak in Wuhan, China into a global phenomenon. So first, between January and February 2020, the disease traveled to neighboring states like Japan, South Korea, Taiwan, and Thailand, which makes sense because, movement between these populations is pretty frequent. But as Professor of Geopolitics Ludwig Jian and others have argued, the way that COVID-19 then spread from populations that were obviously connected to populations that weren't obviously connected in that they weren't physically close was linked to patterns of economic globalization. So when they physically mapped the spread of the pandemic over the first 4 months of 2020, they saw that all the countries that were most directly linked to China economically, mainly rich countries in the global north, were the first to see a rapid rise in cases of COVID-19. And that makes a lot of sense, right? Because if there are economic links between two countries, it means that there will be a flow of goods and people between those two countries that make up those economic links. Obviously, whilst these rich countries had the first major outbreaks, their overall outcomes in terms of death and infection rates over the course of the pandemic ended up being much better, essentially because they hoarded vaccines. But anyway, back to the whole bubonic plague, Middle Ages thing. The trade epicenters at that time were the city-states of Milan, Venice, and Dubrovnik. So this is a kind of pre-nation state. So before there were nation states, there used to be a lot of city-states, and it was Dubrovnik, now in modern-day Croatia, that first implemented an official quarantine policy in 1377 in an attempt to prevent any further outbreaks of bubonic plague. So this policy required all ships arriving in the port in Dubrovnik to wait for 30 days at the port before crew members and passengers were allowed to disembark. This was later extended to 40 days, which is actually where the word quarantine comes from, derived from the Italian quaranta giorni, meaning 40 days. So there's a couple notable things from this example. Firstly, there's the fact that in essence, the very first migration controls were geared towards preventing the spread of disease. This theme of foreign germs is something that we're going to see again in other historical periods that we'll talk about later. So it's worth just flagging that here. Although notably, we did not see that having much effect on policy during COVID when the UK government refused to effectively quarantine anyone, completely undermining all the lockdown measures. So we essentially got the absolute worst of both worlds, where there was rising hate crime against people who were deemed visibly foreign, a lot of them actually just British-born ethnic minorities, and also no effective control on further importation of the virus from abroad. Not that I'm still extremely bitter about the 2 years of my life that I lost to policymaking by a band of infants who apparently could not stop having parties in fucking number 10. Anyway, back to the Middle Ages. The second notable thing we're seeing is that borders being controlled at this time were not located at national frontiers. Indeed, there weren't really nation states at this time. Rather, there were localized borders at the frontiers of cities, which seems quite bananas, right? Imagine having a hard border between Edinburgh and Glasgow. The question of when exactly the focus of borders comes to the national frontier is a bit more contentious. So, international relations scholars argue that the national borders were constructed by something called the Westphalian Peace of 1648.